Hey everyone, welcome to our AI 360 podcast. Super excited to have Adarsh here to talk to us about healthcare and AI. Adarsh, welcome.
Thank you. Thanks, Jim.
Awesome. So, man, why don't we jump into it a little bit and talk about it to me about your role, what you're working on, kind of what you're seeing in the market here around healthcare and AI.
Yeah, let me introduce myself. My name is Adarsh Gosu. I'm a managing director with Deloitte Consulting Services Healthcare Practice. I help our clients become AI-centric organizations and help them transform from healthcare to health.
That's awesome. And it sounds like a great kind of mission focused objective. So, what are some of the things you're seeing trend wise, in the market around healthcare and AI?
In healthcare, I would say adoption of AI evolved from pilot and experimentation stage to be a transformative force across entire value chain. This was not the case a year ago. Now AI is being used across all domains of value chain. You take clinical, patient, provider, revenue cycle management, back office, HR, everywhere AI is being used. And when it comes to patient care, AI is being used to solve a wide variety of problems which are not even possible to solve in the past. Like, for example, precision medicine, creating personalized treatment plans, patient health monitoring, remote care, right, using all these devices, uh, improved patient experience, even if you walk into an ER, like reducing the wait time, is a big thing when it talks about improving patient experience. Early detection of and diagnosis, and the list keeps going on and on. And we see this list keep on increasing as every day goes by, as AI becomes much more sophisticated. Also, there's a big change with the drop in the cost, along with all these technology advancements in personalized medical devices space. Like, for example, glucose monitor, we are actually helping change the mindset. And it is actually shifting from being focused on sick care to well care. And this is actually breaking age-old reactive model of treating diseases to a proactive model of emphasizing prevention, lifestyle choice, and holistic well-being.
That's great to hear that such a positive kind of force for change in terms of how AI is being applied for good and helping to shape sort of this element for patients. As you think about that, I mean, there's got to be a lot of implementation challenges with AI. That the sector's been there for a while. There's a lot of investment. There's a lot of legacy systems that are there. How are you
Mhm.
thinking about like AI implementation, knowing that a lot of those things could be challenges for organizations to try to embrace AI?
Yes, yeah. So on that front, Jim, healthcare is an unique industry compared to a lot of other industries because you have a lot of regulations. Even with all these advancements that happen in AI, there are still a lot of hurdles around usage of AI in healthcare. Like, for example, let's talk about data quality and access to data. This is still an ongoing challenge because healthcare data is so fragmented and it is inconsistent across the entire ecosystem. There is still lack of trust among clinical insights. If an insight is coming out of an AI algorithm, a lot of clinicians and even patients still worry about the accuracy of the algorithms. Then we have all these regulatory constraints. You need to think about uh, how these requirements are evolving and how it's going to impact me. What we really see is a really good, successful organization, if they adopt some type of a cross-functional governance teams, by getting the clinicians, compliance officers, legal experts, data teams, AI teams, everyone on the project, those are the organizations that are really, really successful in implementing AI. And regulators, engaging regulators is the key. Without them, I think your AI projects will be very unsuccessful. And change management is a very important aspect because you are dealing with a spectrum of providers and care managers and clinicians who are in their 20s and who are in their 60s, right? So you need to have some type of change management built in place. So whatever you're rolling out is a successful implementation.
That's great, Adarsh. So let's think like what's your recommendation to leaders? How should they be thinking about moving forward in this space?
There needs to be careful thought, especially with AI. There is a little bit of skepticism when you look at provider sector, the healthcare sector, right? So my recommendation is when you are embarking on an AI journey, have thoughtful planning and clear plan of execution, and collaboration is absolutely needed. I would focus on some strategies like maybe focusing on high impact value driven use cases with a clear objectives and KPIs laid out ahead of starting on this journey. Build cross functional teams with everyone that needs to be involved as part of the team, right? Pilot, validate, and iterate until expected outcomes are achieved, because you may not be able to achieve outcome in the first run. You may have to optimize the algorithm, right? support but not disrupt clinical operation process, because this is a key thing. If you make their life easy, everyone is going to adapt. But if it disrupt, you will have resistance, right? Ensure there's a regulatory oversight is incorporated everywhere. Prioritize change management, which is a key thing, because you can build a beautiful product, but without change management training, it's not going to go anywhere, right? Finally, I would say keep measuring, monitoring, and optimizing AI solutions.
Adarsh, this has been awesome. Thanks for sharing what you're hearing in the marketplace today, and really appreciate your time and all the work you're doing with your clients. Thanks for being on the show.
Thank you. Thanks for hosting me.
Awesome. Take care.